Okay, so since I posted that the first set on the Google Drive, I added a few more questions. So if you see some questions on here that you don't have, don't worry. I'll post this final one with all the answers just as soon as we're done. Okay, try to find a good place to put this. All right, so referring to the schematic at the right, and oh, by the way, so most of my questions, they're either like a derivative of a question, one of Dr. Babasso's practice questions, or it's like a derivative of a practice question I've already written, but like some of them are fresh, so if they look familiar, that's why. Okay, so referring to the schematic at the right, which drug will block C and I? Yeah, so D, atropine, is the correct answer. Somebody want to explain why?
Muscarinic.
Right, it's anti-muscarinic. Yeah, that's right. So what about carvedilol? Where's that going to work? Right, alpha and beta. So what? Right, so G and then one more. E, right. So carvedilol is going to be working at G and E because it's blocking both alpha and beta receptors. What about ergophonium and pyridostigmine? What is their mechanism of action and where would they be working? Right, NN and NM. That's right. So anywhere, right, acetylcholinesterase inhibitor. So anywhere acetylcholine is. All right, what about mecamylamine? What are we working on? Right, it's an NN blocker. Yep, so anywhere you find your NN receptors. Okay, and then last one, propranolol. Right, good job. So your non-specific beta blocker. So, good idea for tomorrow is just to make sure at minimum know the mechanism of action of all these drugs. And if you know that, you can predict its effect, and that makes it a lot easier to eliminate wrong answer choices. All right, how about what is mecamylamine going to block? Right, your autonomic ganglia. Yeah, so NN receptors, yeah, and B, here's the correct answer. Okay, so looking at this tracing here, what drug was likely administered? Right, so phenylephrine, and why would you say that? Yeah, so it's it's an alpha 1 agonist, and you're going to see increased blood pressure and decreased heart rate. Yep, that's exactly right. What would... Oh, I actually think one of the questions that's coming up here is gonna touch on that. If not, I'll go over that. Yeah. Okay. So correct answer there was phenylephrine, and I've included an explanation for some of the wrong answers here. So if you want to go back and look at those, it might be helpful. But I just want to get through these. I know some people are just wanting me to post the answers. Okay. So how about this one? Yeah. How about this one? What's going on? Right, so the correct answer here is dopamine. So with a high dose of dopamine, you're going to see an increase in blood pressure and also an increase in heart rate. And then I included this slide here. So for tomorrow, if you're struggling with this, which I don't blame you, if you can commit this slide to memory, that should help you work through those questions. So I've kind of color-coded the doses and the drugs that you're going to see similar effects. So with a low or moderate dose of dopamine and a low dose of epinephrine, you're going to see a decrease in blood pressure and increase in heart rate. And then with a high dose of dopamine or high dose of epinephrine, you see an increase in blood pressure or heart rate, and similar with norepinephrine. So take a look at that and kind of work through that before tomorrow. Okay. How about this one? Let me move this so you can read. So in number 1 here you have the drug X alone. 2, it's been pre-treated with mecamylamine. And then 3, you've pre-treated with carvedilol. Yeah. So I pulled this question from, so she sent out a set of practice questions on a Word document last year that were pretty difficult. So I pulled this question from that. So the number 1 here, this is drug X alone. So you're looking for a drug that both increases the blood pressure and increases the heart rate. In number 2, when you've pre-treated with mecamylamine, you still get that same increase in blood pressure and increase in heart rate. So that tells you that the drug's effect, or that the effect was because of the drug. It wasn't a it wasn't a reflex response. So basically, and then in number 3, you've pre-treated with carvedilol. So carvedilol is both an alpha and a beta blocker, and it's eliminated the drug's effect. So you're looking for a drug that is going to increase both blood pressure and heart rate, and when you give an alpha and a beta blocker, it's going to diminish or wipe out its effects. Does that make sense at all? Correct. Yeah. So, increasing. So, yeah, so the correct answer here is D. So when Dr. Babos put out this question, she said that with dobutamine, that it's more of a beta 1 agonist than it is beta 2. So you would see an increase in the heart rate with a small decrease in blood pressure, actually. Yeah, so this is like as hard as it's going to get tomorrow. She said that there's going to be 2 blood pressure tracings on the exam tomorrow, and that was true last year too, and they were definitely the hardest questions on the exam. So, yeah.
Is norepinephrine alpha 1 and then beta 1? Is it the 2 it activates?
Yeah.
Okay.
Yeah, and when I post the answers to these, I put her explanation from that practice question down in the comments. So you'll be able to go back and look at that if you want. Okay, so which of the following can be given subcutaneously and why? Right, C. Why does it not cause tissue necrosis? Right, because you're stimulating your beta 2 receptors. Yep. Okay, so this is similar to a question I had written before, but I switched it up just a little. So the graph below shows a muscle twitch strength from an escalating dose of acetylcholinesterase inhibitor alone and in the presence of rocuronium and succinylcholine. Which graph represents a drug whose effects can be reversed by pyridostigmine? Or I guess, actually, Dr. Babos wrote this, but I just played with it a little. Right, you guys got it. So graph A, because it shows rocuronium, a competitive antagonist. Okay. So you have a 55-year-old male who underwent surgery, received a dose of an agent to reverse the paralytic agent used during surgery. He develops pinpoint pupils that are fixed in accommodation, salivation, lacrimation, decreased heart rate, increased blood pressure, and diaphoresis. Another agent was given to block most of these actions, but the second agent did not address one of the actions of the reversal agent. Which paralytic was most likely used? So basically, it's just asking for the paralytic that is reversible. Yeah, good job. So the answer here is rocuronium. And same stem, but just a different question here at the end. So which reversal agent would have been most appropriate? Yeah, so the correct answer here is neostigmine, and that's your, yeah. So neostigmine is an acetylcholine esterase inhibitor. So in order to reverse rocuronium, you're going to give an acetylcholine esterase inhibitor so you can increase the amount of acetylcholine at the neuromuscular junction, and then you'll be able to outcompete rocuronium. Yeah. You guys are kind of beating me to the punch here. So, which agent was appropriately given to block most of the effects of the reversal agent? Right, A. Yeah. So you're going to give an anti-muscarinic. Okay. And then when you give the anti-muscarinic to take care of the effects of your acetylcholinesterase inhibitor, which effect are you not blocking with the addition of the muscarinic antagonist? Right, good job. Hypertension. So, yeah, you should definitely see. She screamed at us. Yeah. Yeah, so you're definitely going to see some variation of that question tomorrow. Okay. So, 72-year-old male patient with a history of dementia and hypertension presents to the ED with profound bradycardia, altered mental status, and profuse sweating. You check his labs and his glucose is low. When checking his medication list, which drug are you likely to find? Right. So the correct answer here is going to be B. This is due to that hypoglycemic effect. So if you have somebody who's, say, like diabetic and on insulin and also taking a beta blocker, the only symptom that's going to like manifest from that is sweating, because if you're on a non-selective beta blocker, then you're blocking beta 1 and beta 2. Okay. So which of the following describes an effect of pilocarpine? Right, hypotension. Yeah, so the correct answer is B, hypotension. And what is pilocarpine's mechanism of action? Right, muscarinic agonist. Good. Okay, and so that brings me to this chart. So this chart is straight out of her lecture, and I would make sure that you review this tomorrow and you know the difference between muscarinic poisoning and cholinergic poisoning from like an acetylcholinesterase inhibitor, like nerve gas or malathion. So with a muscarinic agonist, you're going to see a decrease in blood pressure. Why? Because by giving an exogenous muscarinic agonist, you can activate your M3 receptors on the smooth muscle vasculature. And then with an acetylcholinesterase inhibitor, you're going to see an increase in blood pressure because why? Why do you see an increase in blood pressure with an acetylcholinesterase inhibitor? Right, normal sympathetic tone and activation of alpha-1, yeah. Why are you going to see muscle fasciculations with an acetylcholinesterase inhibitor but not with a muscarinic agonist? What is your acetylcholinesterase inhibitor doing that the muscarinic agonist is not? Right, so acetylcholine is active at the neuromuscular junction, yeah. Whereas a muscarinic agonist, you don't have muscarinic receptors in the somatic nervous system. Okay, so she should test you on this tomorrow in some respect. All right. You have a 5-year-old male who presents to the ED with severe abdominal cramps with vomiting and diarrhea and profuse lacrimation and salivation. Pupillary constriction is marked. His chart indicates that he was recently seen for pediculosis capitis. Which antidote do you give the patient? So what is pediculosis capitis? I think Dr. Colley covered that, right? Yeah, head lice. So first of all, so you went over a drug that's given to treat head lice and scabies. Do you remember what that was? Yeah, so pralidoxime, yeah, that's the antidote. But what do you think he was likely poisoned from? Yeah, malathion. Correct. Right, which is an organophosphate, right. So don't forget flumazenil with your benzo overdose, sodium bicarb with your tricyclic antidepressant overdose, and this is to treat the acidosis that results due to TCA overdose, and then dantrolene is the antidote in malignant hyperthermia, and that can be with your inhaled anesthetics or succinylcholine. Okay, so you have a 30-year-old female being treated for myasthenia gravis with pyridostigmine. She complains of fatigue, weakness, ptosis, and diplopia, especially in the day. You give her neostigmine and her symptoms get better. What is the most appropriate next step? Right, so the correct answer here is C. You're going to increase the dose of the acetylcholinesterase inhibitor because she's having a myasthenic crisis. So if you give her, yeah, sure. So if you give her a dose of neostigmine, which is an acetylcholinesterase inhibitor, you're going to increase acetylcholine everywhere acetylcholine is. So that includes the somatic nervous system. So you give her that dose of the acetylcholinesterase inhibitor and her symptoms improve. This means that she wasn't on a high enough dose of pyridostigmine and her disease is probably worsened. So now you need to increase the dose to increase the amount of acetylcholine present to treat her symptoms. Okay, so the only thing different here is that you gave her a dose of neostigmine and her symptoms got worse. So now what would you do? Yeah, so in this case, you're going to decrease the dose of pyridostigmine because she's having a cholinergic crisis. So this tells you that she's probably had an improvement in her disease. So now the dose that she's on is too high. So prior to an eye exam, a patient is given a drug that causes mydriasis but has no effect on accommodation. What is the most likely identity of this drug? Yeah, so the correct answer here is phenylephrine. Can somebody explain why E is not correct?
Accommodation occurs with E.
Right.
Or it affects accommodation. You have cycloplegia.
Right. Yeah, that's correct. And that's because tropicamide, its mechanism of action is, and I see somebody said it, so it's an antimuscarinic. Yep. So, with pilocarpine, instead of mydriasis, you're going to see meiosis. And then with these other two, you'd also see cycloplegia. So phenylephrine, if you're looking for something that just causes mydriasis but has no effect on accommodation. Okay, so what drug will safely treat glaucoma? Right, A. So why is A the correct answer? Somebody? Why did you pick A? Right, yeah. So, yeah, A is going to result in meiosis instead of mydriasis. Okay. Next one. So, an 11-year-old boy brought to the ER because he started going crazy after eating seeds from a plant while trying to get high. The boy was incoherent, his skin was hot and dry, his pupils were dilated and unresponsive to light. Blood pressure was 180/105, pulse 150, rectal temp 104. So his diagnosis was drug toxicity due to ingestion of a compound similar to which of the following? So this question is describing a certain toxidrome that you learned about. Yeah, so the correct answer here is C, so scopolamine. And scopolamine is a muscarinic antagonist. So this question is describing the anti-muscarinic toxidrome. So hot as a hare, red as a beet, dry as a bone, mad as a hatter, blind as a bat, and full as a flask. Okay. Reflex tachycardia caused by systemic administration of albuterol can be blocked by what drug? So think about mechanism of action here. Yeah, so why are you picking D? Why is D the correct answer? Right, beta 1 blocker to decrease the heart rate. Yep, exactly. Okay, so 65-year-old male presents to the ER following a syncopal episode. His wife says he went to a doctor's appointment last week where he was prescribed a new medication, but she can't remember the name of it. When reviewing the patient's chart, you notice he has a history of BPH and hypertension. Which medication was he likely given? Right. So, correct answer here is doxazosin, which is an alpha 1 antagonist. So that's your first dose syncope, where you go low and go slow when prescribing this drug. Okay, so a 30-year-old G0P0 female, so gravid 0, para 0, so she's never been pregnant. She presents with galactorrhea. You confirm the presence of a prolactinoma by ordering an MRI and prolactin test to confirm the elevated prolactin. So which medication are you going to give in order to manage her symptoms? So think about, would you want to increase or decrease dopamine? Yeah, so the correct answer here is A, and why is that? Right. So, yep, bromocriptine is a dopamine agonist. Yeah. So it should decrease your levels of prolactin. That is correct. All right, so a 40-year-old female was recently started on a medication to treat her schizophrenia. A recent CBC indicates a decrease in the number of granulocytes. Which medication was she prescribed? B. Yeah, and why are you saying B? So what in the question stem led you to choose B? Right, and agranulocytosis. Yep, that's right. Okay, so same stem, just a little bit different question. What other adverse effect is she at risk for by taking this medication? Yes, B. Weight gain. All right, a 28-year-old female presents to the clinic with right lower quadrant pain. She insists she's not pregnant as she's taking oral contraceptive pills, but you talk her into a pregnancy test and it comes back positive. So before you go visit her, you make a list of enzyme inducers to ask her about. Give me some examples. Yep, so St. John's wort. That's probably your ding ding for tomorrow. But what were three other anti-seizure medications that she talked about that were enzyme inducers? Yep, phenytoin, phenobarbital, carbamazepine. Yep. So St. John's wort, phenytoin, phenobarbital, and carbamazepine. What was the anti-epileptic drug that was an enzyme inhibitor? Yeah, good job. Valproate. Okay, so you're on the rounds in the PACU, and a nurse brings your attention to a patient who just came out of surgery. The patient presents with tachycardia, muscle rigidity, rapid shallow breathing, and a temperature of 101.6. What is the mechanism of action of the antidote you will use to treat this patient? Yeah, so the correct answer is C. And what would your diagnosis be? Like, what do you think is going on here? Yep, malignant hyperthermia. As a result of what? What drug did he likely? I mean, just like broadly. Or, yeah, so succinylcholine. Right, yeah. So in this scenario, it was probably inhaled anesthetics because he's in the recovery room after surgery. And I know last year at least, I don't remember how she asked the question, but the answer did have something to do with this ryanodine receptor. So just watch out for that tomorrow. Okay, so which of the following is a symptom seen in opioid withdrawal? Yeah, so the correct answer here is B, mydriasis. So in opioid overdose, you're going to see meiosis. And then one of the mnemonics they teach you in behavioral is to drink cola, dilate pupils. So with cocaine, LSD, or amphetamine overdose, you're going to see mydriasis, and also with opiate withdrawal. So this really helps you kind of narrow down things when you're doing questions. Okay, and then last one. Which of the following is an adverse effect of tizanidine? Yeah, so why are you choosing B? Yep, it's an alpha 2 agonist. Yeah, so you're shutting off your sympathetic outflow. So you'll see hypotension. All right, how's everyone feeling for tomorrow? Not good? I think you'll be okay. How to match drug names with their classes. Yeah, I freak out for every exam I've ever taken. Yeah, same. I do the same thing, Dominic. Yeah, my husband's actually laughing in the background because it's so true. Okay, so do you have any tips on how to match drug names with their classes? I would look for hints in the drug names, like either prefix or suffix. So like your muscarinic antagonist, like what is that little prefix, or like what do you look for? Yeah, tropes and scopes. And then for some questions, I know we need a D1 agonist. Yeah, so that was like that example I gave for bromocriptine. So to treat hyperprolactinemia. Yeah, some of them you really just have to know, but like your tropes and scopes or your beta blockers, like M through Z or N through Z. N through Z is non-selective, and then A through I believe M is selective. So that's a hint. And then like a beta blockers, it's OLOL, so OLOL, or like your alpha and beta non-selectives are ILOL or ALOL. So anytime you can group them by looking at that like prefix or suffix on it, that's helpful. But otherwise, if that doesn't give you a hint, it's really just something you have to know. Like, I wish I had better advice. Hey, you're welcome. All right, good luck tomorrow, you guys. Try not to freak out too much. If you're last minuting it, just go through her Weebots and her red text, and that should definitely. I'm still stuck on this question. You mean this last question about tizanidine? Yeah. Okay. So, do you remember that your Yeah, so remember your alpha 2 agonists, remember they're GI protein coupled? You remember the kiss and kick mnemonic? So alpha 1, alpha 2, beta 1, beta 2. Yeah. So alpha 2 is GI protein coupled, so you're going to inhibit your sympathetic outflow. I just couldn't rule out lacrimation. Sorry, that's my dog. Yeah, so hold on. Let me get out of here. Bring this up. Okay. So does looking at this help maybe? Because if you're inhibiting your sympathetic outflow, then you're going to see reduced saliva flow, or reduced lacrimation. Does that help? Right, that is alpha 1, but let me go here. So remember these alpha 2 autoreceptors? Can you see that? Can you see this right? So right here. So remember your alpha 2 autoreceptors that hang out on the postganglionic sympathetic fiber. So those are shutting off all of your sympathetic outflow. So that's going to inhibit alpha 1 as well. Is that good? Okay, cool. You're welcome. Good luck tomorrow. See you later.